Hello, everyone. Welcome to the Newsbrowse News broadcast. Manitoba has declared a public health emergency due to a significant increase in HIV cases across the province, as reported by Global News. Dr. Brent Roussan, the Chief Provincial Public Health Officer, announced that an estimated 120 cases were reported in the first quarter of this year, following 328 new cases in 2025. A sharp rise from 142 cases in 2021. The emergency aims to enhance access to testing, including self-testing, and to increase the availability of standard blood tests. Cases are concentrated in the Northern and Prairie Mountain Health regions, with Winnipeg having the highest overall number due to its large population. Injection drug use and unprotected heterosexual sex are identified as leading causes of transmission. Dr. Roussan stressed that HIV is preventable and treatable, with effective tools like condoms and harm reduction services available, alongside medications for pre-exposure and post-exposure prophylaxis. Early diagnosis and consistent treatment are crucial, as undetectable viral loads prevent transmission. Notably, more than half of Manitoba's cases are in women, particularly those under 40, differing from national trends. The Canadian federal government has announced that 3 Canadians with connections to a cruise ship experiencing a deadly Hantavirus outbreak are currently self-isolating at home in Ontario and Quebec. 2 of these individuals disembarked the vessel on the remote South Atlantic island of St. Helena almost 2 weeks ago. The 3rd Canadian was on the same flight as the initial 2 and may have been exposed to a symptomatic individual. Foreign Affairs Minister Anita Anand stated that all 3 are asymptomatic and are under monitoring by local authorities. The government is also dispatching consular officials to support other Canadians still on the cruise ship, where 3 deaths have been reported due to Hantavirus. Passengers are expected to disembark in Grenadilla, Tenerife, early Sunday, though this schedule may change. Ontario Health Minister Sylvia Jones confirmed that the 2 residents in her province have been isolating since their return and are not considered a transmission risk, with daily monitoring for an anticipated 30-day incubation period. This report is from the Canadian Press. According to Global News, Air Canada has announced the earlier-than-planned suspension of 4 seasonal flight routes this year, a decision directly attributed to the escalating price of jet fuel. The affected routes include service from Vancouver to Raleigh, North Carolina, ending July 29th, Toronto to Sacramento, California, concluding August 1, Toronto to Charleston, South Carolina, stopping September 6, and Montreal to Austin, Texas, ceasing September 7. The airline intends to fully reinstate these services in the summer of 2027. Air Canada emphasized that passengers impacted by these changes will be contacted directly to arrange alternative travel options or receive full refunds where applicable. CEO Michael Russo stated that this challenge is not unique to Air Canada, but an industry-wide issue affecting capacity, pricing, and risk management for airlines globally. Earlier, flights from Toronto and Montreal to New York's John F. Kennedy International Airport were also suspended in April, with a planned resumption in October. Global News reports that Lakeland's Public Health has issued a critical drug poisoning alert for the Peterborough region in Ontario, concerning a mysterious yellow or beige substance being sold as Down. This substance has been directly linked to a significant increase in overdoses and instances of prolonged and heavy sedation among users. Officials warn of a high risk of overdose and death associated with its use. The health unit advises the immediate administration of Naloxone if a drug poisoning is suspected. However, they caution that Naloxone may not fully reverse the effects if tranquilizers or sedatives are also present in the substance. Symptoms like heavy sedation, blackouts, low heart rate, low blood pressure, or comas may persist even after breathing is restored. Residents are strongly urged not to use drugs alone and to carry multiple Naloxone kits, as several doses might be necessary. Drug checking strips are available at the consumption and treatment site at 220 Simcoe Soaring in Peterborough, and free naloxone kits can be obtained at public health offices and participating pharmacies. The warning is in effect until May 21, and 911 should be called immediately for severe poisoning symptoms. Global News reports that Steve Verheuvel, Canada's former chief trade negotiator, stated on Thursday that the upcoming review of the Canada-US-Mexico Agreement, CUSMA, is unlikely to produce immediate results. He highlighted that both Ottawa and Washington remain too far apart on critical trade issues. The U.S. seeks concessions from Canada, while Canada pushes for the U.S. to address existing breaches of the agreement, particularly regarding steel, aluminum, and auto tariffs. Verheuvel explained that CUSMA exemptions for most compliant goods have notably eased the pressure, making the trade war less of a crisis. This reduced urgency means there is no immediate need for a swift resolution. Prime Minister Mark Carney has also previously indicated Canada's own trade irritants, asserting that Canada will not make further concessions in trade talks with the U.S., emphasizing a bilateral approach where both sides have concerns to address. Bilateral talks between the U.S. and Mexico reportedly face similar challenges. That's all for this video. Thank you for watching. See you in the next video.